The femur is a long bone and the longest, strongest, and heaviest bone in the body. As seen from the anatomical position, the proximal end of the femur articulates with the acetabellum and consists of the head, the neck, the greater trochanter, intertrochanteric line, and lesser trochanter. The femur articulates with the patella and the tibia. From a posterior view, major landmarks are the linea aspera, the pectineal line, the gluteal tuberosity, and the intertrochanteric crest. Looking at the posterior view of the distal end, we see the adductor tubercle, medial condyle, lateral epicondyle, patellar groove, and medial epicondyle. Muscle origins and insertions. Gluteus medius inserts in the greater trochanter of the femur. Gluteus maximus inserts at the upper posterior surface of the femur. Major ligaments include the capsular ligament and the ligamentum teres. The cotyloid ligament connects the ligamentum teres to the hip. At the distal end of the femur, the ligaments connecting the femur to the tibia and fibula are the medial collateral ligament, posterior cruciate ligament, anterior cruciate ligament, and the lateral collateral ligament, commonly known as the MCL, PCL, ACL, and LCL. The proximal end of the femur articulates with your acetabellum. In the anatomical position, the femur is inferior to the pelvis and the most proximal bone of your lower appendages. The most medial part of your femur is the head.
Common fractures or injuries to the bone. Femoral stress fractures are caused when the muscles in the thigh become too fatigued to absorb the shock placed on them. Often hard to diagnose because they are often localized in the hip, thigh, and back. Shaft fractures are generally caused by high energy forces, such as car accidents. Isolated injuries can occur with repetitive stress and may also occur in the presence of metabolic bone diseases and bone tumors.